alarm is growing, and there are ongoing efforts to make people aware that for the first time in 3 years, the federal government is going to be auditing um, the federal government will no longer be prohibiting the auditing at the state level of who will be eligible or not eligible for Medicare. The federal government, when the pandemic started, they said, okay, nobody can be kicked off of Medicare even if their income exceeds the limits, or if they move states, or have other healthcare coverage through jobs or other programs. The federal government blocked that entirely. Medicaid is healthcare system for people who have low incomes and have more difficulty paying for higher prices of health insurance, or have disabled or other qualifications that would enable them to means tested program of federal government program. And now a lot of people are going to be kicked off of Medicare or Medicaid, I mean, because for the first time in 3 years, the states will be auditing everyone's eligibility and starting to take action for um, sending the people off it. Millions of people, some estimate around 14 million, could get kicked off Medicaid, and this is a major problem for people who maybe aren't aware or don't know what to do for if they were to lose their coverage through Medicaid. And there is obviously be they'd have to get coverage some other way. So if someone was to get kicked off Medicaid, which is a process that takes a while. It's not like a one day you're on, next day you're off, and you have no coverage. It takes a while, 9 months to a year in some cases. But if someone were to actually be sent off Medicaid, they could turn to the Affordable Care Act, Obamacare, the marketplace place for their coverage. In some cases, they can get coverage for less than $10 a month in the best cases for them. Um, also, the coverage available on Marketplace will be vastly different from what's offered through Medicaid. Out-of-pocket expenses, copays, are almost certainly higher non for people who are no longer able to receive Medicaid, and they need to see whether their doctors would still be covered through whatever program they move next to, because Medicaid will cover some doctors, but other programs won't. So people need to confirm that their primary doctors that they see will are actually covered by whatever type of health insurance they turn to next. So this is something that is happening just because COVID is over. Like it's basically over. Yes, there's still people dying from it every day, and there's still many hospitalizations, but the public health emergency is getting ended soon, and everyone is basically moved on from COVID, based in the just in contradiction to what it was earlier in the pandemic. So that's why this is happening. So everyone who is on Medicaid should check and make sure that they're still on, that they won't be getting kicked off Medicaid, and if they would lose their eligibility, then uh, figure out the necessary steps after, whatever works best for them. It's different for everyone, and there's no universal plan that says, okay, everyone who gets kicked off of Medicaid should go for this option. Or health insurance in the United States is very complicated, but people have people have ample time, not 12 months in some cases, to figure out what to do.